We'll talk about use of 3D ultrasound compared to pelvic MRI in the diagnosis of Mullerian duct anomalies according to Share and the SGE classification system.
Thank you, Doctor. Hello, everyone. Now I'm going to talk about use of 3D ultrasound compared to pelvic MRI in the diagnosis of Mullerian duct anomalies according to European Society of Human Reproduction and Embryology classification system. Introduction. Congenital uterine anomalies represent 7.3% of general population, 13.3% of infertile population, and up to 38% of population with history of recurrent abortion. Recently, MRI is considered to be the new gold standard in differentiating the congenital uterine anomalies, being less costly and non-invasive method. Later, 3D ultrasound has an equivalent diagnostic accuracy to MRI along with significant low cost and better patient tolerance. MRI and 3D ultrasound have the advantage of providing information about both external uterine contour and the cavity of the uterus. Accordingly, 3D ultrasound could be an alternative to MRI. For decades, the American Fertility Society was the most accepted classification worldwide, being easy to interpret. However, it had difficulty in the categorization of uteri with mixed anomalies, is completely dependent on subjective impressions of the clinician performing the diagnostic test and is non-comprehensive to some rare anomalies. In 2013, the European Society of Human Reproduction and Embryology and the European Society for Gynecological Endoscopy developed a new classification based on the anatomy of the female genital tract. Aim: to estimate the accuracy of 3D ultrasound compared to pelvic MRI in the differentiation between Mullerian duct anomalies according to the European classification system. Subjects and methods. 24 non-pregnant ladies with suspected Mullerian duct anomalies by 2D ultrasound or hysterosalpingography were referred to the ultrasound unit in Suez Canal University hospitals. The following were excluded: claustrophobic patients, patients with non-MRI compatible implants, and patients refusing MRI. All patients had 3D ultrasound and coronal T2 pelvic MRI. All 3D and MRI images were analyzed by 2 senior radiologists. Thank you. 3D ultrasound and MRI images were used to assess the uterus, cervix, and vagina. In the uterus, we measure the mean uterine wall thickness, the external uterine contour, and the percentage of internal indentation, and how to interpret. These are 4 different types of uteri. First, we draw a line connecting the 2 uterine cornua as a yellow line, another line parallel to the external uterine contour, and the distance between the 2 lines represents the mean uterine wall thickness. Then we measure the percentage of internal indentation. This is the classification of uterine anomalies, and this is for the cervical and vaginal anomalies. Results. This chart shows the distribution of uterine anomalies as detected by 3D ultrasound. And we found discrepancy in 3 cases. The first case diagnosed as infantile uterus was turned out to be a normal uterus by MRI. And the second case was diagnosed as partial septate uterus, then turned out to be a normal uterus. And the third case was a normal uterus by 3D ultrasound and turned out to be partial septate uterus. This chart shows the distribution of cervical anomalies as detected by 3D ultrasound, and there was discrepancy in one case diagnosed as a normal cervix by 3D ultrasound and turned out to be a double cervix by MRI. This chart shows the accuracy of 3D ultrasound compared to MRI, and we found that 3D ultrasound has a higher specificity, positive predictive value and negative predictive values in detection of cervical anomalies compared to uterine anomalies. This chart, in comparison between the American and European classification system, we found that there is increased frequency of diagnosis of septate uterus in the European classification. Illustrated case. Case number 1. A 35-year-old female married for 7 years presented with primary infertility. 3D ultrasound showed that there is no external indentation, and the internal indentation is exceeding 50% of the mean uterine wall thickness. And here we can see the septum is seen reaching the cervix, and the diagnosis of complete septate uterus with septate cervix was given. Then the MRI showed the same findings, and here the septum is exceeding 50% of the mean uterine thickness represented by the red line, and the cervix is, and the septum is seen reaching the cervix, and the same diagnosis was given by the MRI. Case number 2, 24-year-old female married for 2 years presented with primary infertility. The 3D ultrasound showed a hemiuterus without rudimentary horn and a normal cervix, and the diagnosis of hemiuterus with no rudimentary horn was given. And the MRI here confirms the findings and a normal cervix, and the same diagnosis was given. Case number 3, a 30-year-old female married for 3 years presented with recurrent abortion. The 3D ultrasound showed an internal indentation represented by a red line is exceeding 50% of the mean uterine wall thickness, and the cervix is normal. So we gave a primary diagnosis of a partial septate uterus with a normal cervix. However, MRI showed that the internal indentation is less than 50% of the mean uterine thickness, and the cervix is normal. So the MRI diagnosis was a normal uterus. In that case, the discrepancy between 3D ultrasound and MRI was due to minor differences in the measurement of internal indentation by the 3D ultrasound. Final case, 16-year-old female virgin presented with primary amenorrhea. The 3D ultrasound showed complete absence of the uterus and the cervix and the normal vaginal canal. And so we gave a diagnosis of a plastic uterus with no rudimentary cavity. And MRI here, as we can see, confirms the findings. Conclusion. 3D ultrasound was found sensitive and specific for the diagnosis of Mullerian duct anomalies according to European classification system, with an excellent agreement with MRI in the diagnosis of uterine and cervical anomalies. No vaginal anomalies were encountered during our data collection period. The most frequently diagnosed uterine anomalies was septate uterus with significantly higher frequency in the European classification system than the American classification system. Thank you.
Thank you, Dr. NOHA. There are no other speakers, so we have time for any questions from the audience to the speakers. If there is any questions or one point not be clarified. I have just a few questions for Dr. Rasha regarding the inter-observer test. What's the observer test used?
Actually, we compared the findings with the pathological data, and we mentioned specific virides reporting for every sequence, and then comparing it with the viral virides to the pathological data. And then we compare the accuracy of our tests to each other and to the pathological data.
I mean the agreement, inter-observer agreement between the readers.
It was a very good agreement.
Okay. So, Dr. Basma, please, one question. Regarding, you used survival analysis for your study. Is that true?
Yes, we used a couple, yes.
Survival analysis, okay. So it's prospective or retrospective?
No, it's a retrospective study.
Retrospective study. And you said you have a multi-regression models. So I don't think you illustrated these multiple regression models in your results?
Well, for the time's sake, we didn't include the study. In the original study, we included also the post-operative complications and the impact of the different composition parameters on the post-operative complications and post-operative time and length of operative stay. We included these parameters within the multi-regression model. But in this presentation, I focused on the survival.
Okay. So there is no any other questions. So we are closing this session, and thank you for all of you speakers and audience, and we can close it. Thank you.